Now, some students had asked for a refresher before this week's Advanced Clinical Skills course on chest pain, but I don't think you need much because you've done this already in your interviewing and your physical exam course. But just for a refresher, what I would do is start with a differential diagnosis of chest pain, and then that will guide the history you want to ask and the physical exam maneuvers to do. But for starters, with the history, just act like a normal person. Introduce yourself. Shake their hand. Ask them why they're here today. That's an open-ended question. Follow it up with, tell me more about that. That's another open-ended question. And if you can wait just 10 seconds, if you can stand that silence, the patient will often give you a lot of useful information. And then after that, simply characterize the symptom. OPQRST. And that's in your ICM-1 handbook if you forgot it. After that, you're certainly going to ask about past medical history, but don't be so general about it. You also want to make sure if they have any history of things that might lead to a heart cause of chest pain, like a history of diabetes or high blood pressure. Ask about family history in general, and specifically anything like this run in the family. Social history you get on everybody. And in particular, you want to know, do they smoke? Because that might be a risk factor for heart disease. And then medications and allergies and so on. For the physical exam portion, that's also pretty straightforward. The vital signs will be recorded for you already by the nurse. Look at them. Are they normal? Are they abnormal? Then simply comment and check out general appearance. Is the person well appearing? Or are they doubled over from their chest pain, or somewhere in between? Then you can ask them where their pain is. If it's palpable, and if you can reproduce the pain by touching there, then maybe, not always, but maybe that's a musculoskeletal cause of superficial chest pain. But you also want to look for heart failure and heart problems. So, as you recall, you can check out the neck. Do you see any jugular venous distension? You can palpate the carotids. Is there a good upstroke, or is it kind of weak? You can also listen for any carotid bruits that would suggest they're at risk for vascular disease, both in the blood vessels and the heart. Then, of course, you have your 4 points of auscultation over the valve areas. You don't want to be listening through a shirt, and you don't want to be listening over the sternum because that's just a bone. Feel for the point of maximal impulse. Maybe it's displaced because the heart's enlarged. You listen to the lungs, right, to hear any sounds that might suggest fluid buildup from pulmonary edema from heart failure. And then where else does fluid back up? You'd want to check the legs, the extremities. Maybe there's edema, swelling. So these are just some general things. In short, you want the history, the differential diagnosis to guide your history, and then the history to guide your physical exam. Now this should be a little easier than syncope, because in general you don't have to worry as much about a neurologic exam. 80% of this, 85% of a chest pain evaluation is the history. So take your time and do a good job. And then the physical exam is very focused, looking for things that can cause chest pain. In terms of your assessment and your plan, simply say, I think it is A, but it could be B, C, or D. I think it's A because of these reasons, things that I've discussed and I've told you about in my presentation of the history and the physical exam. And what would I do about it? You can decide for yourself. Usually for chest pain, depending on what it is, you might get an X-ray or an EKG, but let that be your guide as well. And let's see, what else could I tell you? We're going to send you a bunch of links for information on the interviewing and physical exam videotape reminders, some differential diagnosis chest pain items. We'll also send you the Preceptor score sheet, the standardized patient communication score sheet, but don't worry about the scoring as much. Just get a good story and try to learn from the experience. And good luck.